Thank you for considering the metabolites towards the end of life, or the METAL study. We appreciate your help. You're invited to take part in a study which is looking at changes in your body as your disease progresses and towards the end of life. So, by way of introduction, this research study has been organised by the Clatterbridge Cancer Centre. Taking part in the study will not involve or change your treatment plan. So what's the purpose of this research? Well, we want to look at the changes in your body as your disease progresses and towards the end of life. There's very little known about these changes in a person's body at this incredibly important time. We will use your sample to look at these changes. In the future, we may be also able to use your sample for other research, for example, to help develop various tests and/or treatments which will hopefully improve the care future patients receive. Future research may involve genetic testing, and your participation is completely voluntary. You've been invited to participate because you're an inpatient and have cancer, and we believe your participation will be very valuable to our research. Your participation is completely voluntary. It's up to you to decide to join the study, and if you do, you're free to withdraw at any time without giving a reason. This will not affect the standard of care that you receive. What will happen if you decide to take part? Well, if you agree, we will need you to sign a form that gives permission for us to enter you into the study. We will write in your medical notes that you have given permission to be in the study. We will then collect a urine sample. We will aim to collect a sample once a week. We will also need your permission from you to look at your medical notes. This will be to look at the type of disease you have. If during the course of the study you become unable to provide permission to provide samples for the research study, we will seek to obtain permission for this from someone who knows you, such as a family member or a friend, and this is known as a personal consultee. So this person will help represent your views to indicate whether you feel you would be happy to continue to have samples taken. The person cannot, for legal reasons, be someone who is with you in a paid capacity, excepting family members. In the event of there being no family member or friend available, a healthcare professional will be approached as a consultee. This will be a doctor or a nurse who is involved in your care, but not involved in the research study. The consultee will then be given a consultee information leaflet. If after reading this, they are in agreement with you continuing in the study, they will be asked to sign a consultee declaration form. Only then would we continue with ongoing sample collection. So for this reason, we would encourage you to discuss with your family and friends your participation in the study. All samples collected not used by the end of the study will be destroyed in accordance with the Health Tissue Authority guidance. So what are the advantages and disadvantages of taking part? Well, the advantages to you are that this study could improve the care given to other patients in the future, and there should be no risk to you. The disadvantages to you is that you will not benefit directly from the study, and there is the inconvenience of giving a urine sample. So who is organising this research? The Clatterbridge Cancer Centre is the study sponsor. They will be using information from you and your medical records and ensure it's looked after. Clatterbridge will act as a data controller and keep identifiable information about you for 5 years after the end of the study. To ensure the information we give out is clear, we have consulted with patients and doctors, and a regional ethics committee have given this study a favourable review, meaning they can see the benefit of the research. So how will we use information about you? Well, we will need to use information from your medical records for this research project. This information will include your name and your NHS number. People will use this information to check your records. Researchers, for example, in a laboratory who do not need to know who you are, will not be able to see your name or contact details. Your data will have a code number instead. We will keep all information about you safe and secure. Once we have finished the study, we will keep some of the data so we can check the results. We will write our reports in a way that no one can work out that you took part in the study. What are your choices about how your information is used? You can stop being part of the study at any time without giving a reason, but we will keep information about you that we already have. We need to manage your records in a specific ways for the research to be reliable. This means that we won't be able to let you see or change the data we hold about you. Where can you find out more about how your information is used? You can find out more about how we use your information from www.hra.nhs.uk/information-about-patients/. Secondly, you can ask one of the research team. And thirdly, you can send me an email to Dr. Coyle, and my details are at the end. What will happen if you want to stop taking part in the study? Well, you're free to leave the study at any point, even after the doctor has taken your data. Leaving the study will not affect the treatment you receive from your direct care team. If you have any concerns once you've left the study, contact the research team for help and advice. What will happen to the results of the research study? Well, we will publish the results to the study in a scientific medical journal. This will be a considerable period of time after completion of the study. What is the legal basis for processing of your personal data? Well, according to the new GDPR legislation, we are required to inform you that the legal basis we are applying in order to process your personal data is that processing is necessary for the performance of a task carried out in the public interest. And that's Article 6(1)(e). As we will be collecting some data that is defined in the legislation as more sensitive, i.e. information about ethnicity, we will also need to let you know that we are applying the following condition and law, that the use of your data is necessary for scientific research purposes. If you wish to complain about any aspect of the way you've been approached or treated during the course of the study, please contact the equivalent of a patient advice liaison service. Equally, you can contact Dr. Maria Maguire, who's the head of Research Governance and Sponsorship Research and Innovation Directorate at the Clatterbridge Cancer Centre on 0151 556 5321. And the mobile is 078 246 09720. Where can you get more information? Well, if you would like to take part in the study or you have further questions, so you can contact either the research team or you can contact myself directly. And my name is Dr. Seamus Coyle. I'm a consultant in palliative medicine at the Clatterbridge Cancer Centre. And I can be contacted via my secretary on 0151 556 5928 or by email at s.coyle, so that's s.coyle at Liverpool, liverpool.ac.uk. Thank you for taking the time to consider this study.